Hello everyone, this is Eval, physical therapist, and I get this question an awful lot on YouTube and during my podcast, and it is, what is the difference between disease and patella tendonitis or patella tendinopathy? So today is going to be more of an informative video on what is the difference between the two of them. All right, so if we just chat about a little anatomy here, we will outline the kneecap first. Okay, so I'm just going to take this and outline the edge of the kneecap, just like that. And then I'm going to go down here and hit this little point called the tibial tubercle. And now I'm going to draw in the patella tendon, okay, which is a fibrous band that goes basically from the kneecap. Well, that didn't work very well, so we're going to scrap that one. We got a new color here. So what we're going to do is outline the patella tendon that goes basically from your patella down to this tibial tubercle. It's a fibrous band. Okay, and so first thing I want to talk about is Osgood Schlatters. Osgood's is pain at this part of the bone where this patella tendon attaches. You have this powerful quad muscle that comes over the top. The fibers continue down and attach here. Now we see this very common in 10 to 14-year-old adolescent athletes or kids that are really active and really pushing hard or using this quad really hard. Ice skaters, people who are squatting to do heavy weight, catchers in baseball and softball. And what happens is basically this pulls and pulls and pulls at this growth plate where there are new growing cells, and these cells are a little bit on the softer side. So no different than pulling the skin like this off of an arm. It pulls that bony tissue out and then forms a bump, and that bump ultimately will heal and make like a spur right in that area. But this is most common in those younger folks who are very active. Now, what is patella tendonitis? Patella tendonitis is an inflammation of the tendon where it attaches from the kneecap down to this tibial tubercle. This can happen from overuse, especially lots of running, jumping, cutting, and maybe a change in training techniques. It could be a change in the surfaces that you're running on or walking on. It could be that your feet are getting a little bit flatter. You might develop some tightness in the hamstrings and calf muscles, which will cause an extra amount of strain to this tendon. If it goes on for a long period of time or you sustain some damage to the tendon, it becomes a tendinosis. And then if it's really chronic and there's no more inflammation in there, but still tender to do activities like squatting or going downstairs, then that is considered tendinopathy. What is the difference in regards to treatment? Well, in the Osgood Schlatters, you really just need to protect that bump. You need to slow down on activities that cause a lot of contraction to this quad or anything that requires a lot of deep squatting or heavy jumping or cutting and changing of directions. Sometimes just giving it a little bit of rest can help. Now, putting a patella tendon strap can help take some pressure off here. So a lot of people will put a little bit of like an under wrap here or just a patella tendon strap that helps to take some of that pull off of the bone. So lightening up those activities, improving calf flexibility, wearing orthotics can help with Osgood Schlatters. And if you're going to continue to do activities that cause a lot of trauma to the bone, then putting a knee sleeve that has a cushion in it can be very helpful, like a volleyball knee pad. Now, as far as tendinitis, tendinopathy goes, sometimes just decreasing activity to let this settle down a little bit, and then getting back to that activity slowly can be helpful. Taking some non-steroidal anti-inflammatory medications, as long as your medical provider approves of it or your pharmacist tells you that you can take it, then you can take that. That can help decrease some of that inflammation in that area. If it has become chronic, then rebuilding the strength in this muscle and developing some tension in here and actually working it with some strengthening can be helpful, but that is a program in its own. Today, I just wanted to focus on the difference between Osgood Schlatters disease, which happens in younger folks, and then patella tendonitis and patella tendinopathy, patella tendinopathy, which happens in this area, which will happen with people of different ages, not just adolescent folks. So hope you enjoyed today's video. If you did, give us a thumbs up and be sure to subscribe. Thanks.